When surgery is appropriate and you made the decision to have surgery, our staff will work with you to set up a preoperative visit.
Just going to ask you a couple of questions.
So at the pre-op visit, you'll meet with a preoperative nurse. They usually perform routine blood work, history and physical, as well as an EKG, depending on your medical history.
And you spoke already with the nurse on the phone?
Yes. You have to see the anesthesiologist or talk with the anesthesiologist by phone to make sure that you're a safe candidate for anesthesia and all the things that they're going to do. We do some things in the spine center to try to specifically prevent infection, such as a nasal swab to look for a certain type of bacteria in your nose and treat that around the surgical intervention.
Go through medications, what you can take, what you cannot take, blood thinners, when to stop the blood thinners. Each blood thinner is unique. We want to do the surgery safely.
And how long will it, her recovery be?
This is the moment to ask for questions. And I really want patients to be very open. There's no wrong question, especially if there's a post-op recovery period, pain control, that's your time to really ask the question.
I really go over other types of details. You know, what's it going to be like when you come in that day, how much pain they're going to have afterwards, something that I really spend a lot of time on.
I think it's good to ask about what I'm allowed to do afterwards. How long should I take off work? And every surgery is very different, and every patient is very different because it depends what kind of work you do and how your environment and support you have at home.
A successful pre-op visit will mean that you are cleared for surgery. All of our surgeries are performed on our West Campus in the Rosenberg Clinical Center. You probably know not to eat or drink anything after midnight the day before your surgery, but that's not all you'll need to know.
You do want to make sure that you stop certain medications beforehand, which are discussed at the pre-op visit as well as with your surgeon. You also need to take preventative measures like showering beforehand, before the surgery, with special antibacterial soap that we provide.
The antiseptic soap is important because our skin on a daily basis just holds on to certain bacteria. And when you're going into the operating room and we are going inside your body, which is technically considered a sterile, meaning no bacteria other than your normal healthy bacteria is there, we want to make sure that any of the bacteria from the environment, anything that adheres to your skin, is off.
Before you go into surgery, you can have up to 2 family members or friends with you for support before you go into the operating room. Typically they can wait or they can go home while you're in surgery, depending on the length of your surgery and if you're going to be staying overnight. There is a designated waiting area for your family in the West Clinical Center, so they can wait for you and be comfortable while they're waiting.